Hello, welcome to this Impact for Children webinar entitled How to Be Good. My name is Terry McCarthy. I have over 30 years experience in safeguarding, including holding senior management posts and working as a consultant with authorities who were highly criticised by inspections or internal reviews. So I think I've had a reasonable experience of services which are excellent and those requiring considerable improvement. I left my post as service manager with the London Authority about 2 years ago in order to focus on how safeguarding practice can be developed. It seemed to me that we were under unprecedented pressure with increasing demand and reducing resources, and we needed a more direct focus and purposeful approach to safeguarding, which recognised the complexities of practice and built on the quality of relationships between professionals and families, which involves taking action which leads to real and long-lasting impact on the lives of children, thus the company name Impact for Children. I've developed the Impact for Children website, which contains a lot of the approach, and a book's going to be published in February by Jessica Kingsley entitled The Common Sense Guide to Child Safeguarding. I recommend you take a look at the website. The address is on the screen at the moment. There's a lot of material to download for free. So let's look at what we're focusing on in this session. It's titled How to Be Good and refers to the judgment from Ofsted, and we'll focus on the first year of the new framework. It's a session really of two halves. The first half will look at that messages from Ofsted, and the second half will look at what we need to do to achieve a good judgment from Ofsted, examining a range of examples from developing the culture to developing the workforce to developing approaches with families. So let's start with the framework. The current framework is started last November 2013 and it's now just finished its first year. So this session is based on the 33 reports that were published up to November last month. The framework takes a wide look at the safeguarding multi-agency environment, and it's focusing very much around the outcomes for children, judgments, the journey, the voice of the child, how decisions are made, whether there's unnecessary delay in that, and the strength of relationships and reflective thinking in that. So very much picking up on the key themes from the Monroe Review. Inspections themselves are quite intense. They involve 11 days of on-site presence from a team of normally 6 or 7 inspectors. And here's a list of the kind of things they look at. They're going to look at case files. They're going to look at a mountain of material produced by the authority. They will observe meetings, the shadow workers. They will meet with practitioners and managers and service users, children and families in all kinds of different contexts. The inspections cover, I'll pop all these up. They cover 5 key areas. There's the overall effectiveness, which is the judgment, which is the headline judgment. And in order to come to that judgment, they will look at children who need help and protection. This includes children subject to CP plan, but also children in need and children in private fostering arrangements. They will look at looked after children, and there's 2 subcategories within that, which they call graded judgments, which relate to adoption and leaving care. Fourthly, they look at leadership and management and governance, and then finally the effectiveness of the local safeguarding board. So it's quite a wide examination of the safeguarding environment. So there's 4 Ofsted judgments. The least of these, the lowest of these, if you like, is inadequate. And this is where an authority is considered to have what Ofsted call widespread or serious failures, which have led to children being at risk of harm. Now, in the last year up to November 2014, 6 authorities out of 33 were judged as inadequate, so that's 18%. Moving up from inadequate, we have requires improvement. This is under the previous framework called adequate, but it appears now that adequate isn't adequate, and meeting minimum standards, minimum requirements is not good enough anymore. It's no longer considered to be acceptable by Ofsted. So that's what requires improvement is really about. No child is considered to be at serious risk. Children are generally protected and served, but it's all done to minimum requirements. So it's basically regulations are met, legal processes are met, procedures, policy, best practices generally met across the board. And of the 33 that were inspected in the last year, 18, so just over 50% were considered to require improvement. Moving up from that, the next category, and the highest category that any local authority has achieved so far, is good. And that's where there's effective services which help protect and really go a bit further than minimal standards there. We'll talk more about what good means in a second, but it's really achieving more than simply minimum. And 9 authorities, 27%, have been inspected and considered to be good in the year up to last month. And the fourth and final category is outstanding. Now, no authority in the last year has reached the outstanding overall judgment, and this is where it's highly effective. So this is good and better than good. So it looks as though 3/4 of authorities so far have, or almost 3/4, almost 75%, are either inadequate or requires improvement, with just over a quarter being considered as good. So the focus of this session is how can we work with as inadequate or requires improvement authorities to get the standard of practice up to a good level. Once we've reached that, we can then start to aspire to achieve an outstanding. So some key messages coming out of this. I've got 10 messages relating to practice and another 10 key messages relating to management. So 20 messages in total. We'll run through them fairly quickly. The practice ones, the key messages coming across all of the reports, particularly those that were inadequate or requires improvement, was that there was poor assessment. There was a lack of recording, lack of use of chronologies, delays in taking action. The journey of the child, the voice of the child, the experience, feelings, views of the child were not adequately considered. And children were not seen on their own on a regular basis. There was a lack of reflective learning, ineffective core groups, and this related to both the presence from agencies but also how effective the core groups and multi-agency working was in terms of pushing the plan forward and achieving best outcomes for children. There was inadequate response to children who were missing from school, and in terms of the leaving care there was poor pathway planning, and in terms of adoption there was poor permanency planning. So this is 10 areas of practice that consistently turned up across the reports. I don't think any of them are particularly new. They're messages that have been seen in many previous inspection frameworks, serious case reviews, and many internal audits within authorities. So let's look at the 10 management issues. Lack of early intervention, poor and inconsistent supervision. This has been confirmed by other surveys published over the last year. Lack of management oversight and decision making, drift of cases or cases closed when they shouldn't be. Caseloads are too large. The lack of good retention and recruitment strategies, and this has led to an over-reliance on locums and many changes of social worker, which has created difficulties with continuity of service to families and children. Unclear corporate parenting role. Thresholds feature in many reports. They're often seen to be too high. They're often seen to be misunderstood or unclear. And there seems to be a lack of real clarity about what services are trying to do. There's a lack of contingency planning, so if the main plan isn't meetable, what happens next? Lack of clear systems and a lack of effective quality assurances, and we'll talk about more of this in a second. So another 10 messages. Again, none of these 10 are particularly new to us. We've seen them for many years. And they suggest an overall failure within management and a failure within practice to really get the practice and the intervention with children and families effective and really resulting in major changes for children. So to become good and lift up from requires improvement, it's not enough to be simply meeting the minimum standards. Regulation, legal requirements, policy procedures, best practice, we've got to be doing more than minimum standards. Good means that these basics are going to be met effectively, they're going to be met consistently, and they're going to be sharper, quicker, more pointed than those authorities that require improvement. So in some ways it's difficult as you look through the reports to see why some authorities were judged as requires improvement and others as good, or indeed even why some were inadequate and others requires improvement. These are very subjective judgments by Ofsted. I think they would accept that one team of inspectors might come to one judgment with authority and another team may come to a different judgment. It's a continuum and there's arbitrary lines drawn within that continuum. So there's somewhere where you could get a very good requires improvement or quite a poor good, and they might be very, very similar. But at some point doing a bit more, being a bit sharp, a bit quicker, will lead to the judgment of good. And the key bit is in achieving good is that it's making a real difference to children's lives. This is the crux of it. And those authorities that require improvement, there really was insufficient and consistent evidence that the interventions were making a difference to children's lives. So a lot of process, a lot of activity, a lot of tasks completed, but no real evidence that it had got underneath the risks of the case and the needs of children and really shifted those. So, how can we become good? Now, the most common response to how to improve services within children's services is to follow the kind of what I'm going to set out seems to be 4 steps. First of all is develop and implement new guidance, new standards, be clear about what's expected of managers and practitioners, set performance targets. Secondly, communicate these to staff, management and practitioners. Monitor through performance management systems, supervision, vigilance of management vigilance, monitoring, case monitoring, auditing, etc. Whether these expectations, standards, targets are being met, and if not, address non-compliance with teams or individuals. It seems to me that that approach, which is very common, and indeed is the most common response to a very critical inspection, is that the improvement plan tends to be very much based on these 4 common responses, these 4 steps. Often lots more procedures and requirements to be met, lots of meetings, lots of communication, lots more tighter monitoring and more compliance checking and bringing people to task, teams or service managers, team managers, practitioners, for why they haven't met those. And I think what this seems to be based on to me is that the problem is one of clarity of purpose, and where there is clarity of purpose, a lack of compliance with that clarity of purpose. However, the practice and management issues that we've looked at a few seconds ago, those 20 points coming out of the inspectors, have been around for so long, and that suggests to me that they're more fundamental than simply expecting workers to work better or work faster, or it's got to be about something much more basic than that. And in order to look at that further, I think we need to start looking at the nature of safeguarding as a problem. Now there's 3 types of problems, and this was based on work in the 1960s by Rittel and Weber. They talk about tame, critical and wicked problems, their model of the 3 types of problems. I don't like those terms so much, so I've changed them a bit for the purpose of this, but basically the ideas are similar. The first of the three problems I would call simple. And these are straightforward. This is where A follows B, D follows C. You can very clearly define that in this situation you do this, in that situation you do that. Fairly straightforward. This is the kind of response we might make to a referral that requires signposting or some information or advice. You can very simply say, offer them this advice, refer them to this agency, and this process can be followed in a fairly straightforward manner. The second type of problem is called critical or crisis. And this is where there's quite a serious difficulty, but the response to it is fairly straightforward again. The best example of this is a fire alert. There's a standard operational procedure that's nailed to the wall, screwed into the wall, that says what you must do, and there's fire marshals that will rally people out of the building, down the right staircase and out of the building. And providing those procedures are clearly written down and followed, the critical or crisis situation will be addressed. In these kind of situations, there's no reason to have a discussion, to have a focus group to discuss how we're going to do it. You just follow the standard operational procedure and follow it through. So in both these simple and critical problems, procedures are very useful, guidance is very, very useful, clear direction is very, very useful, and complying with that will get the job done. The third problem, and the one that I'm going to argue is most relevant to the issues around safeguarding, is what's called complex problems. Now these are problems that are by nature difficult to understand. It's difficult to understand exactly what's going on. And a lot of the reason for this is that they relate to a number of different elements that intertwine, interlinked, affect each other, mutate with each other, so that you're never quite sure what you're dealing with. And in fact, it's sometimes said that you'll never, even at the end of the case, the end of the situation, you only then might it be clear what was happening. But as you move through the assessing and planning process with families, the complexity of the issue means it's not really clear how to proceed. And therefore, the guidance, direction, procedures may be helpful as checklists and as timescales and that, but they're not really going to give you real detail or help with how to respond. So let's have a look at this in a bit more depth. Safeguarding is complex because there's many aspects to be looked at. The problems are often entrenched. The root reason why children are mistreated often relates to issues such as alcohol abuse, drug abuse, untreated mental health problems, learning disability, emotional difficulties, criminal behaviour, attitudes to children. These are very entrenched behaviours and attitudes that we're trying to understand and address. There's a combination effect, and this means that it's never, every case is totally unique and different. There's, elements will impact on each other and combine together to create a very difficult to fathom picture. Information is changing, emerging. It's never quite clear, day by day, fast changing circumstances. There's a high level of anxiety and fear, and this leads to often incomplete, inaccurate, distorted, concealed messages and information, where people's commitment is being sometimes misrepresented, sometimes distorted. It's the situation is just a very difficult one to get your head around. In order to do this, we need this level of skills is required. Now I've got these up on the screen as one because it's just worth running an eye down them very quickly, maybe pausing this this film in order to examine these and think about them in a bit more detail. But as you can see, there's an enormous amount required to deal with complex problems. You've got to have a lot of ingenuity, you've got to be very sensitive, responsive, you've got to probe in there, ask the right question, listen to what's happening, respond to that in a very sensitive and exploratory way, involved in some challenge, a lot of creativity, a lot of judgment. And All of this is expected of newly qualified social workers for about £25,000–26,000 a year. So it's easy to see how getting these levels of skill from practitioners is it's a challenge. And it's that challenge that we're here to examine at this session. So, procedures, clear direction, monitoring, accurate information systems, ensuring compliance are all very good and they're all necessary, and in a time of professional and public accountability we really must have those. However, they're not enough on their own, and what we also must understand and work with is the messiness, the complexity of and examine the qualitative aspects of why children are being harmed and what we need to do to address that. And we need to use the combination idea again, but this time to combine how we visit, how we meet, how we discuss cases, how we assess, how we plan, how we record, how do we examine the case to create a congruent, cohesive approach. So I'm going to look at some examples now. Over the next 10 minutes we're going to look at some examples of how this might work in practice. The first couple examples relates to culture. Now, culture is defined by Peter Drucker as something that eats strategy for breakfast. In other words, the attitudes, the beliefs, the values of an organisation is what really drives and determines what they do. Now, culture itself, I like the definition of how we do things around here. It's a very simple definition. It's about the behaviours and the attitudes and the values of the organisation, and this is what we need to be examining. Now, an important part of this, and an example I'd like to draw from this, is how we develop healthy relationships. Now, these elements of healthy relationships are applicable to all relationships, whether it's parent to child, couples, friendship relationships, or professional relationships. So we need to treat each other with value, dignity, respect and courtesy, a very basic one. We need to be trustworthy, and for me that's about being consistent and appropriate. We need to really good listening and rapport and really good communication, open and honest. We need to resolve conflict. We need to challenge and value differences, sometimes valuing them, sometimes challenging them, but this is depending on what the difference really is. We're going to need to enable positive change. We need to become better as a result of the relationship, and we need to understand the authority and accountability and responsibility. The session next week will really start to examine issues to do with authority, accountability and responsibility. These are really important issues. We won't go into much detail now, other than to say that authority is a constructive definition of authority. How do you get people to do what they need to do in a way that doesn't intimidate or demean them? And accountability and responsibility, these two terms are often used interchangeably, but the important way to separate them out is accountability is what has happened. It's why a child has been harmed, for example, and who did it. That's where the accountability lies. Responsibility is about moving forward, and that's about what are we going to do to find a solution to the mistreatment of the child. So these are the elements of healthy and effective relationships. It's important within a cultural context of safeguarding to look at those relationships as existing between managers and practitioners, between practitioner and practitioner, between practitioners and parents or carers, and ultimately between parents and children. So these elements of effective relationship have got to be modelled going down the hierarchy, if you like. And if managers are talking to practitioners or managers are talking to each other in a way that's demeaning or disrespectful or not valuing them and not engaging in the healthy aspects of good relationship, it's very likely the practitioners are going to model that distortions, that dysfunctional behaviour when they talk to parents. And what we need to do is really start to instill these healthy and effective relationships. In this way we start to really get into the complexity of how people relate to each other and try to use that to draw out the best possible outcomes, ultimately to the benefit of the child. Now, a second example from culture relates to performance management and quality assurance. Now these two terms are often used interchangeably. Ofsted talks about quality assurance systems, And performance management, performance information systems is often a term that's used as well. And I think it's worth thinking about how these two things are different. Performance management, I think, tends on the whole to be addressing quantitative measures. So this is about, have visits been done, was the supervision done, was the child seen on their own, is there chronology on the file, is recording up to date, so forth. These are tasks that can be ticked as a yes or a no. And they're quantitative. It is important that we gather quantitative information on these things, because unless a visit has been done, it's pointless to start talking about the quality of that visit. So we've got to get the visits done first. And indeed, many authorities who are inadequate have been judged to be inadequate because they aren't doing the visit, they're not seeing the child, the assessments simply aren't being done, chronology simply aren't being done. So actually getting these things done on a quantitative level is definitely a step forward. However, we also need quality assurance, and by its definition, that's about the qualitative aspects. This is where we can start to look at the complex issues that we're talking about, the dynamics within families, the dynamics between professionals, why a child's been harmed, and what we can do about that. Now, the qualitative issues, there's many ways you can get into quality issues. The trouble with these is they're nebulous, they're not tick boxy, they can be commented on and discussed, but they're not. There's never an end to the process of qualitative assurance. So we need to be auditing cases and getting that into a learning loop. Case discussions at all levels will be useful. Observations, consultation, coaching. I do a lot of coaching with groups and individuals, really trying to get at what is the complexity of this family, of the issues that are affecting this child. How can we get this family to change? Can we get this family to change, or do we need to be taking the matter down the PLO route and start to think about legal proceedings? And getting feedback from children and families. One of the best ways to get quality assurance is face-to-face work with the child. If a child is clearly showing themselves to be happier now than they were a few months ago, that's a very, very good qualitative indicator that something is changing within the family. Okay, so now let's look at a couple more examples relating to the development skilled workforce. Now, some of the complexities relating to development workforce relate to the massive amount of caseloads, the complexity of the problem we've already seen, drug, alcohol, untreated mental health problems, learning disability. These kind of issues are very complex and entrenched. Evasive, hostile families, insufficient involvement of partner agencies as resources reduce, are becoming less and less available. Expectation to be creative. There's no getting away from the fact that if you're trying to be creative and to try new ideas, it involves taking chances. You may misjudge that. It's relapse and mistakes are an inherent part of that, and we need to find a way to do that in a way that doesn't create unacceptable risk. And people are feeling vulnerable and anxious. So that's some of the context. Now here's some of the ways in which we can develop practitioners. Now, formal and informal supervision. The work I did with the London Authority recently, managers felt that 60% of the time was spent in informal discussion with workers. The problem with that is it's often unrecorded, unstructured. There was no follow-up on it very often, and it was often done in a rushed way. Formal supervision, even if we meet in the 1.5 hours every 4 weeks, with an average caseload of 15 children, that works out at 6 minutes a case. So clearly we cannot get involved in the heavily qualitative issues within a formal supervision. So formal supervision is very, very important to monitor the broad aspects of a caseload and how a worker is doing, but it cannot be a place to really start to have an in-depth discussion. Whilst training and guidance is useful, one of the approaches that I recommend is that we've got to get more involved in coaching and case consultation and auditing and case monitoring, and using this to look much more at how can we shift cases, what's going on and how can we shift it, getting involved in that qualitative discussion. And joint working is another very good way in which two heads are better than one, and when we're looking at very complex, difficult situations, it's really a good idea to not leave it to a single individual, particularly if they're an inexperienced or an anxious practitioner. The more people that can be involved, the more likely that the qualitative issues are going to be addressed. Let's have a look at support. Support and challenge, really important part of all relationships. Now, we need to think more about what is constructive support and constructive challenge. Constructive support is where you're supporting people to be where they need to be. If you're supporting individuals to be somewhere that's unhealthy, that's collusive, and that's not support. So supportiveness is about moving people to a place where they can meet their responsibilities appropriately. Challenge, similarly, at an extreme end, is not about intimidating and confronting individuals, and ultimately that can often be experienced as a bullying kind of intervention. Challenge is about working within, understanding where somebody is at, and really gently but effectively moving them forward. And it's this kind of support and challenge, this constructive, what I call support, constructive challenge, is where people really can learn. And this is what this quadrant here that I'm pointing at with the mouse at the moment, high support, high challenge, but done very, very constructively. We're going to finally run through the management styles. And what I've been arguing really here is that we need a mixture of management style and leadership styles. So yes, we do need to have clear expectations, clear monitoring of compliance. Those things are really important. Our public, political and professional accountability requires us to do this. But we also need to mix that with encouraging the creative thinking, encouraging the reflective thinking, the getting underneath what's happening, developing people's motivation, inspiring individuals to really get a bit of confidence, get a bit of pride in what they're doing. And we need both of those aspects, and we need to mix those styles in order to move forward. And through all that, to develop a nurturing environment. And finally, we're going to look at some examples of how we can get involved with the complexity of cases involving engagement with families. Now, families, as we've already said, are very entrenched. Timescales that are expected of improvement are often not consistent with the needs of the family, often not poorly motivated to change based on fear and anxiety, and they can often be defensive or evasive and avoiding the impact. So there's a lot of demand for practitioners and managers to really deal with here. Let's look at some aspects of how we can get involved in the complexity by looking at plans and planning, assessment and assessing. Now, President Eisenhower stated, "I've never achieved anything without planning, but I've never seen a plan that achieved anything." A fascinating quote. And I believe that what he was saying in this was he was drawing a differentiation between what a plan is, which is a static thing that you've written and typed up and printed off, and the process of planning, which is active and dynamic and is a verb, and it's continuing process, never ending, the whole process of planning. And this kind of language can also be used in terms of assessment and assessing. An assessment is the thing you print off. It's signed, dated and put on the file, and is very important in terms of defining where we were at a particular moment in time. But real effective practice is around the continuing process of planning and assessing. So the line in the sand to compare against is useful, but we must be looking at the process, the continuous evaluation process. We're going to be examining this in 2 weeks' time on the 18th of December, in the webinar I'm doing then, when we're going to be looking at the 13 steps of continuous evaluation. But to get us moving here, I'm going to suggest 4 key questions. So I'm calling the WIPE questions. WIPE just because, well, we'll see where WIPE comes from. But if this is a way of trying to remember 4 key questions And if you can stick to these 4 questions, I think you'll make a real difference to the outcomes and move forward from process-driven practice to a more qualitative approach. The first of these is to ask the question, why is a child being harmed? And this relates to, particularly to the root factors. These are the fundamental issues I've already mentioned. There's a limited number of these. You have alcohol, substance misuse, drug misuse, learning disability, mental health problems, violent tendencies, criminal behaviours, attitudes to children. These are the fundamentals. There's probably about 7 of these in total. And these are the root problems that really relate to virtually why all children are being harmed. So there's a limited drop-down menu, if you like, of these root problems. The second question, the I question, is what impact is that having on the child? And this is where we need to be talking and understanding the experience of the child. The third question is there a workable plan, P for plan, to address the root problems? And the fourth and crucial one is the E question, which is evidence of progress. So there's not much point having a plan if there's no progress in that. Evidence of progress is absolutely what we need to be seeing in order to be achieving good quality intervention. So hopefully these 4 questions worth hanging on to. If the word wipe helps, great. Otherwise, whatever way helps you remember, great. But it's why a child's been harmed, the impact of that child, is there a plan, and is there evidence of progress? Okay, so that draws us to an end. So some key points from the webinar. The Ofsted frameworks have found about 3/4 of local authorities as being good. Not being good, as being either inadequate or requires improvement. We need a real ground shift to get to good. It's not enough just to simply work better, work harder. We've got to really rethink how we work with families, how we work with colleagues, how we work with our partners, and how we develop a culture. Meeting statute requirements is not enough to get you to good. We need to build the confidence and the courage to work effectively with families and to support each other to do that, recognising the complexity and the difficulties inherent in that. And safeguarding is about ultimately it's about the quality of relationships and the exchange between professionals and families. If we can really get to that issue, I think we'll really start to understand the complexity. Okay, so that's the end of this webinar. Just next Thursday's webinar, we're going to be looking at morale and resilience and starting to focus more on the pressures on practitioners and how that level of overwhelm can lead to poor practice and lead to process-driven work. We'll be looking at the continuing professional development and some of the conflicts and dilemmas inherent in practice, a little bit more about what we started to talk about tonight, and how to build the skill, confidence and pride. So join us. The webinar will be, the joining instructions are on the bulletin board at www.impactforchildren.com. If you aren't able to be there at 8 o'clock on Thursday evening, you will be able to watch a recording through the website, which is loaded on YouTube from the following day, from Friday next week. But hopefully you'll be able to attend that. And just, if you have anything you want to talk to me about, contact me. These are this is my email address and the telephone numbers. And by all means, just once again, visit the website, download some of the material there. Hopefully you'll find it very, very helpful. Okay, I hope you find this webinar really helpful, and many thanks for watching. Goodbye.